started. Welcome everyone to our training on the CDCS Unbundling project. My name is Cindy Greben. I work obviously at DHS. I work on the Home Care and Self-Directed Services team, which is part of the Disability Services Division. I have been at the state about 15 and a half years. 2 of those years I was in DHS licensing, and the remainder of the time I have been at in Disability Services Division, and one of my primary policy assignments has been CDCS. Prior to my time at DHS, 25 plus years, I was working in disability services, primarily in community residential services. So I have a lot of different perspectives sometimes. That doesn't mean I know everything about things, but it's been interesting to see how services to people with disabilities have evolved over the last 40 plus years. Today we have a few presenters. I'm going to introduce our next presenter, who is my colleague Rebecca Fee, to introduce herself and tell us a little bit about herself. Rebecca?
Thanks. Hi, I'm Rebecca Fee, and I have been working with Cindy and DHS in home care and self-directed services for about 2.5 years. Prior to that, I've been working in with waiver programs since 2001 at counties, at Clay County and then at Becker County. So shout out to both of those counties if anybody's out there. So yeah. I want to also give Dawn Clemmer an opportunity to introduce herself. As some of you may know, Libby Rossett-Brown in Aging, AC, and EW, as it concerns CDCS, retired in May. And so Dawn's been hired as her replacement. And Dawn, I'll kick it over to you.
Hi, everyone. Yeah, thanks, Rebecca. I am on day 10 here at DHS, working in the Aging and Adult Services Division, primarily with the elderly waiver and also to support CDCS and CFSS for aging services. Previously, I worked at Dakota County for 9 years, again in aging services and also as a supervisor, and have worked in the aging field for a long time. So that's really where my interest and my passion lies. So glad to be here and helping to support the presentation. Thanks.
Okay, thanks, Dawn. Also, I just want to mention we do have Diane Benjamin listed as a presenter on our PowerPoint. She is not able to join us today. So it'll be the 3 of us actually doing the presentation. Next slide, please. A couple things we just wanted to say is that we do have the cameras disabled of all of the attendees, and actually as we do our presentation, I know I probably will be off camera too, which is sometimes easier, and it provides better internet connection. As we're moving on with the presentation, we do welcome your questions. We know that we're covering a lot of information today. We welcome your questions. We're going to be using the Q&A feature on the webinar, so feel free to use that feature. We're asking that you try to ask questions that are more general, because I know that as you're listening to information, you might think, oh, I wonder how this is going to impact this particular case, this particular person, and it just might prompt some more case-specific questions, and we would prefer that we not do that. It would be way too difficult to answer the detailed scenarios or case-specific questions. But just know that what we're doing today is really a high-level introduction to what the changes are for unbundling. We also have worked on all of our policy pages, and a lot of additional information will be available to you. So when we implement this unbundling, just know that there's going to be plenty of resources. So today's really intended to be more of a high-level explanation, introduction to what this really is. We do have time after every segment for an opportunity to ask questions. So it's really helpful for us too if you could ask the questions, during that time, or that's relevant to that particular segment. Sometimes, otherwise it gets a little confusing when we're kind of jumping around a little bit, but feel free to use that Q&A feature to type in your questions, and we'll do our best to answer them. If we're not able to answer them at this training today, we're going to be compiling all of these questions and we might, publish some Q&A types of questions to be able to address some things that maybe we've seen that we didn't cover that have come up during these trainings. The other thing I wanted to mention is that we have scheduled 4 separate webinars, but they are all identical. So if you are now attending today's training, there's no need to attend another one because it'll be identical to this one. So I think that we just wanted to clarify that some people thought maybe they had to, attend all of them. So, all right, so I think we're going to get started. And I am going to turn my camera off for now so we can move on to the next. Thank you, Dawn. All right, so here are the topics we're going to try to address today. So when we think about unbundling, I know that people have been hearing about this for a while. It's been talked about for, a couple of years, actually. So what exactly is it? What does this mean when we talk about unbundling? The other thing we want to talk about is why is it necessary? Why do we need to change anything? What's the purpose of it? The other thing we're going to address is how exactly are those CDCS service categories changing? When we talk about unbundling, we talk about separating things out, and so how is that going to look for the service categories? The other thing we're going to address is some things that we have done to clarify policy or update policy. And as we were working on this project, it gave us a really good opportunity to take a clearer look at our policies, not just because of unbundling, but also to be able to clarify things that have been common, misinterpretations or something that maybe wasn't covered in our policies. And so we will talk a little bit about some of those things today. The last thing we'll discuss is how this is actually going to be implemented. When's this going to happen? How are we going to do this? How is this going to impact people? And we want this to be the least disruptive way for people. We don't want this to disrupt services to people. So we'll talk at the end about how and when unbundling will be implemented. Okay, next slide. So really, the unbundling really refers to redefining the CDCS service categories to keep like items together. So when you think about how we've set up CDCS all these years, we really refer to CDCS as different CDCS service categories, because CDCS is really simply a way for people to utilize their waiver dollars in a self-directed way, right? So that's really what self-direction or consumer direction is, a way to use those waiver dollars in a self-directed way. What we've had all along is being able to differentiate how people are using those dollars by allocating money into different service categories. So we always refer to those different areas as service categories. So to make a distinction on how monies are being spent. And so when we talk about keeping like items together, a good example was environmental modifications and provisions. That is a current CDCS service category. And when CMS was looking at our program fairly recently, they were saying, what does a home modification have anything to do with transportation or adaptive clothing or equipment and supplies? Because we had a category called environmental modifications and provisions. So that was something that they said, we would like you to keep like items together. The next slide this is really where this originated. So So CMS kind of was taking a look at our program, and they first asked about these services or service categories. And again, as I mentioned, they were talking about not only just keeping like items together, but really clearly defining the service definition of each of those categories. You know, what exactly were we referring to in each of those categories? The other thing that they asked us to do is to clarify provider qualifications. So who exactly is providing the service, or what is the service? What's the definition? Who's actually providing that particular service? How is the provider qualified? They really wanted us to take a closer look at provider qualifications for each of those service categories. And then who's verifying that those providers are qualified, who's verifying or confirming any credentials or monitoring. So that really, in a nutshell, is kind of what this is all about. It really is about taking a closer look at all of these service categories, splitting things up to make them clearly defined, keeping like items together, and then really looking at who is actually providing the services in those separate categories and what are their qualifications. Next slide, please. So as you know, here we have the current CDCS service categories: personal assistance, treatment and training, environmental modifications, and self-direction support activities. Currently, we have a person that chooses to self-direct their services through CDCS has a state set CDCS budget. That annual state set budget for that person is authorized on a service agreement as one separate line item. Their authorization, the annual budget that they have, they use that amount to then create a CDCS community support plan, and those funds then need to be allocated in one of these service categories. So everything that they want to use their dollars on needs to be in one of these service categories. What's going to change will be the service categories will expand, and I'll go to that in the next slide, but nothing will change with authorization for CDCS. So right now we have people that are authorized as one single line item for CDCS annual budget, and it will remain the same even when we unbundle. The only changes and differentiating how we're going to report out or determine how people are spending their money really happens on the claims side. So we use modifiers for that. We can go to the next slide, and I'll kind of show you my visual here. So this is really the picture of what this is, what the changes are. And you can see too, I know that we have mostly lead agencies and CDCS support planners probably on the line, but we also, next to each category, where we also have our modifiers. And for people that may not know, the modifiers are simply being used on the claims side. So when claims are submitted to DHS, it will say it was under personal assistance, U1, it was under environmental modifications. So we just needed to expand not only the categories, but then we had to add some modifiers, but that really is going to be happening on the claims side. So personal assistance will be personal assistance. There's not a new category. Treatment and training will also be treatment and training. Environmental modifications and provisions was split. So CMS asked us to split environmental modifications not only between home as one and vehicle modifications as another, but then also that provisions part that I talked about earlier. What exactly is that? So we have created a new category called individual directed goods and services. That really is what you'll all be familiar with when we talked about the provisions part of environmental modifications and provisions. A lot of those items, and we'll talk about that in more detail later on, but our hope with doing this is that a lot of the things that people are getting and using under CDCS will still, they will still be able to do many of those same things. It may just be in a different category. The other current category, self-direction support activities, was really that administrative part of how much does it cost to actually implement this plan, and that is payroll taxes, employer share payroll taxes, the FMS fees, the CDCS support plan, or any of those types of more administrative costs. Sometimes you think of it that way. That was all under self-direction support activities, and we will no longer have that. And we will have a separate service category for FMS and a separate service category for CDCS support planner. And that was, again, really, we were getting a lot of direction from CMS to do this the way we're doing it. You also added a new service category called community integration and support. And so we'll talk in more detail as we move forward here, but this is pretty much our visual of going from 4 service categories to 8 service categories. But as you can see, it's not probably as daunting as people may have thought. Some of it's just really the way we're putting on a plan and the way we're billing it. Okay, let's go to the next slide. So, you know, this is one thing that we talk about at almost every single training. It's just kind of a reminder. And the reminder really is when we, again, think about CDCS and we think about people utilizing their waiver dollars in a self-directed way, we have to remember that these are waiver dollars. And so although CDCS allows people a lot of flexibility and choice and control, there's still some parameters around the use of waiver dollars. So we always talk about really applying the basic waiver criteria for allowable expenditures, and that is just a standard guideline, right? It's standard criteria. So anything that you use waiver dollars for any good or services must be included in the person's plan, must be necessary to meet a need identified in the person's assessment. It must be related to the person's disability and or condition, and it must be for the direct benefit of the person. So these are just that basic waiver criteria that is viewed as really the use of any waiver dollars, regardless of whether you're self-directing or not. That's kind of our place to start when you think about evaluating goods and services for people. And the next slide, please. And then this is the list of, you know, the criteria that says these are 1915C waiver dollars, and there's certain guidelines surrounding that too of when you can't use waiver, ways you can't use waiver dollars. So one thing would be that you know, obviously this is, you can't use waiver dollars if something was provided before that plan was developed or something was approved, and it must be in the support plan, or things that are recreational diversionary in nature, items that are comfort or convenience, things that might duplicate other services in the support plan, anything that would substitute natural supports. Another one, we hear about this one a lot, right? Things that are not the least costly and effective means to meet the person's needs, and things that are available through other funding sources. And we'll talk about some of these things a little bit as we move along too. Waiver dollars also can't not pay for the cost of educational expenses or pay for the cost of utilities. Next slide. So right now, I wanted to know if there's any questions about that particular section. Okay, let's see. Are any of my teammates seeing anything?
This is Rebecca, and I am not seeing anything. I think maybe we just give it another 30 seconds here.
Okay.
Looks like there might be a question coming in. Go ahead and type that question into the Q&A, Jennifer.
The service, so the question is, were the service limitations set by CMS or DHS? I guess I would need to know what limitations, service limitations. Yeah, so just so you know so the question is such as the service that cannot be provided for comfort. All of the things that I just covered have been in our waiver plans for many years, and on all of our waiver plans are reviewed and approved by CMS. So some of the basic things that you're seeing or I'm talking about with comfort or convenience or least costly, some of that standard language has been in part of our waiver plans for many, many years.
There's a question about defining diversionary, and I think we're going to talk about that a little bit later. Right?
Yeah. We'll talk about that a little bit later. And just, yes. And see, I want to be able to help answer some questions, but I also know too that some of these things, some of the questions aren't specific to unbundling necessarily, not that they are important, but they aren't not necessarily specific to unbundling because a lot of it's basic waiver criteria. It's not necessarily CDCS specific. It's just standard, kind of some of the parameters surrounding the use of waiver dollars. Okay, anything else?
I'm not seeing any more questions, but we'll have another opportunity for people to ask at the end of the next section.
Okay, well, Rebecca, you're up.
Okie dokie. So we'll talk about the first category, the first unbundled category, which this one happens to be going to be the same as it currently is, which is personal assistance. Next slide. So we'll just clarify a couple things. We are publishing a updated policy page for personal assistance when the unbundling becomes effective. And so there's just a little bit of a discussion about what you'll be seeing. So one of the things is we're going to be providing a definition about what activities of daily living are. And so on the new page, it will say that activities of daily living are those that include bathing, grooming, dressing, toileting, positioning, transferring, mobility, and eating. We will be providing a definition of the instrumental activities of daily living, or IADLs, and that will say that activities that are activities that include meal planning and preparation, paying bills, shopping for food, clothing, and other essential items, and performing household tasks that are integral to the personal assistance service. And then we will be defining caregiver relief as a break for a primary caregiver while the person receives support from another worker. And then we're also going to be updating the page to clarify that personal assistance category is for directly hired workers, that these are direct support workers that are in this category. And they are directly employed by the participant. We are also updating the page to include that personal assistance services can be provided remotely. And then we're also updating it to clarify that the policy around worker ratios, that the ratios are assumed to be 1-to-1, one personal assistance worker for one client or participant, unless the person has an assessed need that requires more support than one worker can provide. And then there's some things that need to be defined and assessed and included in the plan in order to be approved. And next slide. Okay. And so obviously, because we're no longer going to have the service category of the self-direction support activities, personal assistance category will now include the employer-related costs that previously have been housed in the self-direction support activity area. And so these costs include the employer-related costs of fees and taxes, as well as benefits. And next slide. Okay, some additional updates. We are adding information about the criteria for providing bonuses to directly hired workers onto the personal assistance page, as well as some more guidelines and considerations to determining worker wage rates. We are also providing a reminder that personal assistance services are they're direct support services and need to adhere to the overall waiver policy of out-of-state travel, so that workers cannot be paid while traveling outside the country and providing assistance. And again, this is a waiver policy, not something specific to CDCS. It's just a reminder that it applies to CDCS personal assistance workers as well. And the next slide, please. Okay, policy clarification. So for non-covered services, so we've just are going to be updating this personal assistance policy page to include that services that function solely as a substitute for childcare would not be covered under personal assistance, as well as the services and tasks that a spouse or parent of minor is typically responsible to perform. And also, again, services to the person when they travel outside the country would also be not covered under personal assistance. We also mention on the page now that the person or their representative could not be reimbursed for administering the plan or the duties of hiring, training, and managing workers. And already changed to the next slide. Okay. So then we talk about the provider qualifications, and as Cindy mentioned, that's one of the specific reasons unbundling was necessary, and the qualifications, provider qualifications, need to be more clear throughout our categories, and so the provider qualifications are that the workers must pass DHS background study for personal assistance workers, meet the individual provider enrollment requirements, receive individualized training from the person or their representative, be able and willing to provide the service-related responsibilities that are outlined in the person's plan. And then a new thing that we had to add here too is that personal assistance workers must follow incident reporting and manual restraint standards. And so just a couple little notes here too, that we need to make sure that the workers are qualified to do the job they're being hired to perform. And also when we talk about being able and willing to provide the service related responsibilities that are outlined in the plan. And we've kind of updated the information on the page to include that this would mean that if a person is needing morning grooming tasks, for example, but the person that you want to hire is only available in the evenings, that it may not align with that person being able and willing to provide the responsibilities as they are needed. The person also that is hired should have the ability to communicate and the ability to perform the tasks that they've been hired to complete. So we've just put a little more information about what being able and willing to provide the service means, and are updating that in the policy page. And next slide. And we're already at questions. Let's see, Cindy, I think we're seeing a few questions here already.
Yep, we are. So can I just jump in?
Yeah, go ahead, please.
Okay. Well, there was a couple things I just wanted to, well, let's answer the questions first. One question was about shared services. So in part of Rebecca's presentation, she was talking about worker ratios, and that was really referring to more than one worker working with an individual at the same time. So, that happens periodically where somebody has some high behavior needs, medical needs, and they're requiring two workers for that working at the same time with that person. And that's what we clarified in policy, because it really wasn't anywhere, and that comes up periodically. And we just want to make sure, and we get a lot of questions from OIG with their fraud investigations, just to say that's okay to have, okay to do, and as long as it's in the plan. The question about one worker working with multiple people, the one worker with 2 people or 3 people, that shared services, and nothing's changing with that. There's no changes to that. So whatever's in place right now would be able to be continued as it always has been. There's no changes to that. We were just clarifying the other way around, when it's more than one worker working with a person at the same time. And then, the other question, Rebecca, was about can agencies be hired for personal assistance?
Yeah. So agencies cannot be hired for personal assistance, but you could hire a PCA agency, is my understanding. Is that correct, Cindy? And
Yeah, the other thing too that I just this is a good time to mention too, is that currently, we know that CDCS offers people the opportunity to, self-design services or hire, their family members or neighbors or friends, or have a little bit more, freedom in choosing some of their workers. But just know right now that anybody that is on CDCS or, utilizing their waiver dollars through CDCS always have the option of using those waiver dollars to purchase any traditional waiver service that's available to them under the waiver that they're on. So nothing is preventing anyone that's on CDCS to purchase, individualized home support or any formal traditional waiver service they could do right now. I know that's more costly, but they do have the option to do that, or state plan PCA services. They could do that also. There isn't anything that's changed about that. Okay.
But I just put in the answer but the personal assistance category is for directly hired workers.
Right. Yes. And so the other question then is about when a parent of a minor child is providing personal assistance to a child, do they need a background study? Yes, they do. Anyone that is getting paid with waiver dollars, providing services, direct support services like to personal assistance services, need to have a background study regardless if they're the parent or not. Another question, can you say more about the individualized training? For those who have been on CDCS with a long-term worker, will there be an expectation for training or documentation of previous training? Rebecca?
Yeah, I think what we're talking about is the slide note that says receive individualized training from the person or their representative. This is not new.
Yeah,
it's not new. It's just how we're explaining it on the policy page is maybe a little different.
Right. Yeah. So there's nothing different about that. That's what happens now, right? So when a person is hired by whether it's the participant or the family, when a support worker is being hired, they're typically the ones that are providing the training to that worker. So that the information that we provided for provider qualification just simply states that. I don't know that we ever really stated it that way, and that's all that is. So, and there's not necessarily, documentation of that training. It's just the expectation that the person has to be willing to be trained by the person or the family. And then Sarah asked a question about when is this unbundling going to occur? And as I mentioned earlier, we will be talking at the end, the implementation. And somebody's asking about I sure could use a better understanding of tasks that normally done by a parent or a spouse. And I don't know that we're going to necessarily be talking about that specifically. You can always look at our policy page right now. There are some examples on that policy page. The policy page is titled Paying a Spouse or Parent a Reminder for Personal Assistance. And there are some examples on there. Any other questions?
Well, I guess we'll go ahead and move on to treatment and training. Do you want to flip this?
Sure.
All right, so for treatment and training, you can advance the slide. The category isn't changing, but there's a couple of things that you need to know about this category and how it's looking different, a little bit different here. So covered services under treatment and training will include specialized therapies, behavioral supports, and then training and education for caregivers and for the person. And you can advance the slide. So because there's been a lot of confusion about treatment and therapies, etc., we have clarified the service definition of the treatment and training to be specialized therapies and behavior supports, and have added this definition to our federally approved waiver plans. And you can see here it's specialized therapies and behavior supports are services that a Minnesota healthcare program medical provider prescribes to relieve the person's disability and or health condition. Next slide. And specialized therapy and behavior supports covers the following criteria. Prescribed by a MHCP medical provider licensed to practice in Minnesota. This can be a physician, a physician's assistant, or advanced practice registered nurse. Something that is not available through other funding sources, such as medical assistance, and relieves the person's disability and or condition. So as before, specialized therapy and behavior supports must meet all of those criteria. And because there's been some confusion surrounding what it means when a service is not available through other funding sources, such as MA, we'll be covering that in a little greater detail in a different slide. And also just a reminder for this one that a recommendation or a note, even the prescription by the medical provider, doesn't necessarily mean that it can be approvable, because the items must meet all basic, the services and items must meet all basic waiver criteria for allowable expenditures before it can be approved, even under this category here. Next slide. Now, we have created some new forms to be used for the specialized therapies, and we are no longer going to be using the CDCS alternative treatment form. The new forms will be similar to the existing CDCS alternative treatment form in that they need to be reviewed and signed off by the person's medical provider. The lead agency still needs to review the form and ensure, like I said in the previous slide, that it meets, that the proposed service meets the basic waiver criteria and allowable and unallowable criteria, even if the medical provider has signed the form. And you'll note here, the two new forms are the CDCS Specialized Therapy Request Form, which is DHS 5788. That form is currently the CDCS Alternative Treatment Form. So it will have a new name and a little bit of a reformatting on it when that comes out. The CDCS Behavior Support Request Form, of course, is the DHS 5788B. And these forms will be available when unbundling is effective. Let's see, next form, or I'm sorry, next slide. Too many forms. For the training aspect of the treatment and training, this is really kind of unchanged in the fact that the training is for unpaid caregivers is still defined as services that pay for training and education to support the caregiver's ability to care for the person. And the training and education for the person still means that services are paying for training and education to increase the person's ability to manage their CDCS services. And next slide. The treatment and training, non-covered services. So what we really want to point out here is non-covered services includes items or goods. So treatment and training services just means that this isn't a category where goods belong. Goods will go in a different category, the individual directed goods and services area. And so the forms will be used for services only. So non-covered is items or goods, experimental treatments, fees that are incurred by the person, such as MA fees, copays. It cannot be used for prescription or over-the-counter medications, premiums, copays, animals, service animals, related costs, medical treatment or services that are available through other funding sources, such as MA state planner waivers, and medical treatment or services that exceed MA coverage limits. So this section is specifically about services. So an example would be maybe MA covers 20 speech therapy sessions. When those speech therapy sessions are exhausted, waiver cannot pay additional sessions under treatment and training. It would be the same kind of thing for, like, say, dental cleanings. Person gets 2 a year. It's not going to be, waiver isn't going to cover additional cleanings. So that's what this means when we talk about medical treatment or services exceeding current MA coverage limits not being covered. And ultimately these non-covered items are the same as we've had in the past. We're just kind of clarifying and pointing out the items or goods specifically. Let's see, I think we can go ahead and go to the next slide. So the other thing is, again, the provider qualifications. We want to talk about those because, again, the unbundling requires that we kind of look at these, and like Cindy had said in the beginning. So specialized therapies and behavior support providers must meet certification or licensing requirements in the state law related to the service being provided. So the example on the slide here is hippotherapy. So hippotherapy, if someone has a need for it, a doctor has signed off that they need that, they've filled out the form, the lead agency has determined that it can be approved. It has to be purchased from a provider who is certified by the American Hippotherapy Certification Board. So for example, if maybe visiting, say, a hobby farm and engaging with horses may provide therapeutic benefits, for example, that farm or person running that farm is not a therapist providing hippotherapy. So just wanted to kind of use that as an example. And let's see, next slide. So for training providers too, so this is unchanged. The training and education providers must hold the relevant professional licenses, the credentials and certifications required by state law. And if there are training and education needs that do not require professional licenses, credentials, or certifications, then the person can define in their CDCS CSP what qualifications those trainers need to have. So again, this is not a change to any policy. They just must hold those relevant licenses, and I think we're all familiar with that. So we can go ahead and go to the next one. So the verification of provider qualifications. So we are clarifying on our policy pages that before the person receives services for treatment and training, that the case manager must verify that the provider holds the license, the credential, or the certification that's required by state law for the service, that the provider has not had any state or county agency contracts or provider agreements discontinued due to fraud, ensure that the provider has not been disqualified under a criminal background check according to the standards in the Minnesota statutes, Chapter 245C.03, which is the Background Studies Act. And if a state law does not require the provider of the service to hold a license, a credential, or a certification, that the case manager is responsible to verify that the provider meets the qualifications in the CDCS CSP. The person must maintain the documentation of those provider qualifications. And these are not new requirements. And we just want to point out too that a lot of these are very similar to lead agency approval option services that lead agencies have been approving when maybe someone isn't enrolled and they want to use them for certain services. And so lead agencies will already have kind of a process by which they verify these things. And next slide. So available through other funding sources. So this slide is the one we were talking about earlier, where we said we would take a little closer look at what does this mean, because basic waiver criteria does state that an item or service can't be funded with waiver dollars if it's available through other funding sources. So if a service is available through another source, the person must work with the source responsible for funding that good or service to access it. If the person is denied for the service, the person has to follow the reconsideration or appeal process for that funding source. So this does not mean that if MA doesn't have coverage, that waiver will pay. So for example, a person may need some dental work that maybe isn't covered by other health insurance, such as MA. And that doesn't mean necessarily that waiver can cover it. And an example that's listed here is of a chiropractor. So if a person is unable to find a chiropractor in their area that accepts their medical assistance, waiver dollars is not the payer for that. Waiver dollars are not intended to replace the health insurance coverage. So the person would need to seek the treatment from a provider who's enrolled with MA. And then waiver obviously can't pay for the chiropractic service because it is available through other funding sources, even though it may not be with a preferred provider in the person's local area, but it's still covered. And another example here is, there's been a lot of conversation in the previous training we did about incontinence supplies. So we want to make sure that it's clear to everyone that incontinence supplies, which is not a service, this is just about services, right? So incontinence supplies are available under MA, as well as additional excess amounts. And waiver funds can pay for additional supplies after all the MA funded amounts are exhausted, including those exception amounts. So we just wanted to make sure that that was said as well. And the next slide is questions. I'm sure we may have a couple. I would bet we have at least one. So we'll see. If you want to go ahead and pluck those
Rebecca,
into Q&A.
Yeah. Well, so Rebecca, this is a good segue because a person has a question. I believe you may have just answered it, but I'm just going to read it because the question is, let's say a person has MA and has speech therapy. It's covered under their health insurance, but the parent wants to receive speech therapy from a specific provider that is not covered. Can CDCS fund that service in that circumstance? And the answer, and actually very similar to Rebecca's chiropractic example, is that waiver can't pay for that, and that is because that person still has service coverage. She has coverage for that service. Speech therapy is covered for that person, so waiver wouldn't be able to pick up that particular speech therapy, even though, and I think, we talked about this a little bit yesterday at the training. I think that one way to think about it is that, remember this, we're talking about health insurance, right? The waiver was never intended to be used in lieu of or instead of their medical or health insurance. And I guess I would when I think about people and their waiver dollars, I would want them to be using their waiver dollars for and not have to spend their waiver dollars on things that their medical insurance covers. So similar to if, we all have medical insurance and there may be a provider that I prefer to go to for whatever reason, but they might be out of my network. So now there's some cost to that. So, it's similar with this is that person, they might want to go and see speech therapy from a different provider, but that provider is not an MHCP provider for speech therapy. And just because they want to go to that provider doesn't mean they don't have coverage for speech therapy. So waiver wouldn't be able to pay for that. Hopefully that made sense. There was another question, Rebecca. Well, I'm going to just say, there's one question. I don't know that it's kind of out of scope here for what we are talking about today, because that's way bigger than like CDCS, but it's the question is, how are service animals typically paid out? Are they paid out of pocket by the beneficiary? So that's a bigger question that is really out of my expertise. So we're really talking about CDCS, and that is a bigger waiver type of parameter, I guess, not just CDCS. Okay. So the other question is, can you inform us where to find whether or not a provider holds the license? MHC provider lookup or DHS provider lookup, or you take their word for it? Rebecca, you want that, or do you want me to?
Well, I don't know. I think we could, I guess, Cindy, why don't you go ahead and just address, I know you know your way around the provider lookup better than I do.
Yeah,
so
well, and the other thing too is it's not just all about licensed. I mean, not everybody's licensed, right? Some people are enrolled, and there's a variety of ways to search, but there is a DHS licensing lookup for, let's say, 245D providers, or a variety of, home and community-based services, and on that licensing lookup in the right margin, there's also a place where you can search people that are maybe MDH licensed. There's a home care agency, they have a comprehensive home care license, or they might have an integrated license where they are able to provide 245D. So there's just a variety of ways to kind of look up different things for that. So the other question then is, can you go through the specific steps that a case manager would take to confirm all of those items on slide 27 for treatment and training qualifications?
talking about, I mean, they're very similar to the approval option steps.
Exactly. I think you might want to explain that, go into detail, Rebecca.
Well, so certain services can be done through an approval option through the counties or lead agencies, where it will say on that list, whether a service requires background studies, or whether it requires an attestation or other kind of agreement or contract between the county and that person. So I would say start with that, take a look at that process. How does your county currently do that? And then that should help answer a lot of those questions. I think each county might be just a little bit different on how they do those things.
Mm-hmm. There's another question. I think I can answer it if it's okay, Rebecca.
Yeah, go ahead.
Okay, the question is, we currently put formal service providers, such as their example is MRCI for day support services, or a provider doing individualized home supports. So those are traditional waiver services. They typically put those right now in treatment and training. With these changes, with these types of services still go in this section. Really good question. they would not go in this section anymore. We're going to put those under individualized, individual directed goods and services. So any traditional waiver service that a person wants to use their CDCS budget to purchase will go under individual directed goods and services. So it's a really good question though, because you're right. Some of those traditional waiver services right now are being put under treatment and training. Okay, the next question says, for verification of qualifications, et cetera, did you say that the participant needs to provide the information and then case manager needs to make sure that information is correct? Or does the case manager need to review each provider on their own to come up with that documentation?
And I can address that. In the slide, we indicated that the person needs to provide what the qualifications would be for the service that they are wanting to get, right? So they're supposed to list the qualifications. I think I have that right, Cindy.
Yeah.
Yeah. And then it also says the person will keep the documentation of the qualifications for the provider. Yeah.
Okay, so there's another one that the question is, I ran into the same concern about the previous one we talked about with choice of provider, and somebody wanted to use a speech therapist that wasn't an MHCP enrolled provider. The parent was upset because it should be their choice of who they go through for a service provider if their MA wasn't accepted. You know, I think the other thing too, you guys maybe have to just try to take a step back to remember that we're talking about medical services here. We're talking about medical services. There's no, if there's somebody that isn't enrolled, DHS has no relationship with that provider. We're talking about medical services now, right? Medical. DHS has no oversight. DHS has no relationship. That person's not doing. They don't have to bill. It's all through the FMS. There could be providers. Let's just say that are maybe DHS. This is just an example. I'm not saying this is happening with all these scenarios. I'm not saying that, but I'm just trying to frame it up a little bit. If somebody was, let's just say somebody had a negative sanction against them, or they were a provider that was revoked or terminated, or some type of negative action, right? And they were terminated by MHCP or the provider enrollment people or licensing or somebody, right? There would be no way that any of us would know that they could continue to do what you're suggesting here and not be enrolled and still be providing medical services to a person. Because they're getting paid through the FMS. So I don't know about anybody else, but my choices for my medical and health insurance is somewhat limited too. We have some limitations on what's covered. We have limitations on who our providers are, who we can select, our hospitals, our clinics, and there are some limitations there too. I think that's pretty, that might be pretty standard for health insurance. So this is not, we're not talking about, a piece of equipment that was denied and waiver might possibly be able to pick it up. We're talking about medical services. So hopefully that clears that up.
So I think that's it.
Okay. One more, Rebecca. One more here, and I think because we talked about services, MA coverage in excess. This is now we're going the other direction that we did yesterday. So the person said, if I'm understanding correctly, the waiver cannot cover any above and beyond MA coverage, but the waiver can cover supplies in excess of MA coverage, like diapers we use. So this is where people were, when we talk about, there was a slide that said, we talk about not available, through other funding sources. And then there was a slide that's talking about in excess of MA limits. So that's where I think people were getting confused yesterday. So we today tried to clear that up to say, when we talk about in excess of MA coverage limits, we're talking about medical treatment and services, extra cleanings, extra dental cleanings, or, those kinds of things. We're not talking about equipment and supplies.
Mm-hmm.
And nothing's changing with any of this, you guys. I mean, nothing is changing. What we were trying to do is clarify, simply because of kind of some of the examples that people are asking. Well, if that provider isn't available to me, then it's not available through MA. And that's not what we're talking about for medical services. So that's what we were trying to clarify. Hope that answers that question. Yeah.
Well, let's see. I think, Karen. Go ahead and maybe we can continue to go here on the individual directed goods and services. I just want to say, if there was a question that you don't, that people, have additional questions on this, there will be a slide at the end on how you can contact us with additional questions. I think there's a couple that maybe are going a little outside the scope, and so we can answer those for you later on.
Yeah, and I know that you guys, these are really good questions, so we're not trying to not answer or not help, because these are really great questions. We know that there's, we're trying to do high level, and then we kind of get deeper, and we want to be able to answer the deeper questions, but we get all these questions afterwards too. So whatever we're not able to answer verbally here, we will be able to address. That'll help us to understand kind of if we're not being really clear. All right, so the next section we're going to talk about are individual directed goods and services. Next slide. Okay, so this is really a new service category, but it allows people to use their budget for items that were previously covered under that environmental modifications and provisions. So we talked about that earlier, right? That's going to be all those things under environmental modifications and provisions. That was transportation, where we were paying for some environmental support. So we had some chore like, services, house cleaning, supplies and equipment, including assistive technology, adaptive clothing, additional or specialized food. All of that used to be under the provisions part of environmental modifications. All of that stuff is still, it hasn't gone away. It's just been moved now. It's moved to individual directed goods and services. So really, part of this individual directed goods and services, not part of it, the actual definition of it really came from some CMS guidance too, and something that other states use also to describe what exactly this is. And the services or the goods must decrease the need for other Medicaid services, promote inclusion in the community, increase the person's safety in the home. That's very high level, that's very general. But that's kind of the idea behind the individual directed goods and services. So some examples on the next slide. So this is where I just mentioned most of these things, supplies and equipment. That's where this will go. The transportation, so that was the mileage reimbursement that was covered under environmental mods. The one thing that will go under here that may have gone in a different category, we know that a lot of people use home care nursing services that are performed by independent contractors. There's many CDCS folks that are utilizing nursing services through use of independent contractors. That will go under in this category, individual directed goods and services. That's the services. The other thing too is I mentioned environmental supports. That's the house cleaning, lawn mowing, snow removal. That all is going to go under individual directed goods and services. We have the ability for the health club or fitness membership for adults that goes under here. Adaptive clothing goes under here. Additional or specialized food goes under this category. And just to note too, we did create a form specifically for those additional specialized foods for those prescribed diets. And it's DHS 5788A. So what we did was we took that alternative treatment form and we really split it into 3 to kind of make it usable for the different pieces of what people are asking for. Specialized therapy, that's 1. Behavioral support, that's 2. The other one is the additional or specialized food for the prescribed diet. But all of that will go under this category. And then the other thing that will go under this category will be modifications to recreational items or activities. So we'll talk a little bit about that as we move forward. Next slide. Okay, so some of this is kind of a repeat because some of this is really standard waiver plan criteria for things that aren't covered. Like, for instance, the prescription or over-the-counter meds, we talked about that earlier. That's something that waiver can't pay for. Room and board, personal items, some oral nutritional products, items that do not provide medical or remedial benefit to the person. The other thing is, this is a big thing, and that is another direction from CMS about utilities, and that is in our general waiver plan language for basic waiver criteria, that waiver doesn't pay for utilities. In this case, this will affect people that are currently using the CDCS funds for internet access. That is something that CMS has directed us not to do, not to pay for, and that will affect people. I think that's one of the biggest things about this. When I talk about unbundling, I talk about the fact that people, a lot of our folks out there, just want to know that they're still going to be able to get the services and things that they've gotten previously, and they may not care which category it goes in, but they just want to make sure they get the service or the stuff, right? This is one area that I think will affect people, because there are people, a lot of people that are using CDCS budgets to pay for their internet. So that is something that CMS has said that we can't do. Even though we've had it in our waiver plans and it had been previously approved, it can no longer be. Other things that this category can't cover are items that restrain the person or restrict their rights, any tickets or related costs for sporting or, events or recreational events, and then we talked about the service animals, and that again is kind of a basic waiver criteria too. Next. So the other thing too is this is when we talked about recreational diversional, right, or diversionary. This is things that we have been in conversations with internally and looking at other states, and a lot of talking about, consulting about what exactly this is. So CMS has said, and it is part of the, I look at the 1915C technical assistance guide that CMS puts out, and that really is for states to write their waiver plans and give us guidelines. And in there, it does say that these dollars can't be used for items that are recreational in nature. So we know that that has been part of our, general waiver criteria for a long time. So that language has been there. But we also know too that this has been super challenging to interpret. And so we know that the interpretations will vary across the agencies and the counties, exactly how they're interpreting that. What is it? How do you evaluate that? And what can be covered? Our current policy hasn't always been clear on how to evaluate what waiver dollars can pay for. We know that people talk about this is related to the person's disability, but what is recreational and what isn't recreational? So this has been a huge topic of conversation for a long time. So the next slide So here's a good example. Here's the thing that we've said, and we've said this for really many, many years. When we think about things that are recreational or things that the waiver pays for in relation to modifications or adaptations to an item. One thing that we have said, and this is something in policy question that's been there for a long time. So we get requests for bikes. Okay, bikes are typically considered recreational in nature, right? And sometimes you could view bikes as being an item that would normally be provided by the person or their family or parents or or themselves, right? Like I buy my bike. So even though waiver dollars can't purchase the bike, waiver dollars can be used to modify that bike, to adapt it, to make it usable and functional for the person due to their disability. So there is the same thing with any kind of play equipment and that type of thing, right? So if we know that people obtain something like a bicycle may have already been adapted. They're just going to buy a 3-wheel trike for an adult or something like that. What we've said about that is that if they want to get a bike and the bike's already been adapted, that the county could kind of estimate the person's portion, like what would a bike cost? I mean, what's an average cost of a standard bike, and then that would be the person's contribution, and then the waiver could really pick up the remainder of that cost of that bike because of all the modifications that were needed for that item because the person is not able to use the standard item. So I think the way to think about it too is that when we think about waiver dollars, we think about waiver dollars being used to modify or adapt. I mean, we don't buy the vehicle, we modify the vehicle, or the house, but we modify the house or adapt things for people, but not necessarily the item itself. That's really hard to think about, but that is kind of the way we're trying to approach this when we think about recreational. So the other thing too, when we talk about recreational activities, when we talk about recreational activities and community inclusion and community integration, we want people to be out there. This isn't about them not encouraging people to be out there, but we know that waiver dollars do pay for people to support them to participate in recreational activities, to get on the community. Waiver dollars do pay to support that, and they're doing that by paying a worker to drive them. We're going to pay, CDCS is going to pay them. CDCS will pay the worker their mileage. CDCS will pay the worker their time, not only just to drive them to wherever they're going, but the waiver dollars will pay that worker to remain with that person in order to support them while they're participating, to fully integrate, to fully participate in whatever community activity they're participating in, whether they need physical assistance, whether they're attending something that support worker is helping to help them because their speech is difficult to understand, or they have, they'll need some extra, hygiene assistance while they're there, something like that, right? So when we think about recreational activities, supporting people to participate in recreational activities, just remember that there is some waiver support and contributions to some of that. As far as the next slide, please. So as far as the activity themselves, CDCS funds could pay for the additional cost of any type of recreational activity like camps, any sports, leisure, hobby or craft classes, any sessions like that. There's been a class that has been modified or adapted or any specialized to meet the person's disability related needs, whether that means that class or session or sports session needed special instructors. They needed like the person needed like a one-on-one, or the any additional staff, and they have a smaller class size because they may be working with people with some physical challenges, or they're using some specialized adaptive equipment. If there are additional costs to that particular camp, sports, leisure, hobby class, the waiver would pay for that additional cost. And we say because of these activities are considered recreational, then the coverage is really limited to the additional cost when they would exceed the cost without modifications or adaptations. So the one thing that I know that we've talked about over the years, and we're trying to adapt it to a little bit more overall to have it make sense. We have been asked questions about, well, this is years ago, swimming lessons. Now you have somebody who wants to take swimming lessons, and this child is not going to be successful in this typical group session, and they need individualized classes, or they need an extra instructor in the water, or they need something extra, right? What we've said is that if that person, we typically would, right now we're saying, well, swimming lessons are typically paid for by the family, or any parents would have their child attend swimming lessons, and that's something they pay for. But if that child, because of their disability, needs, let's say they won't, like I said, they're not successful in that group session, and they need to have a private swimming lesson, then the waiver could pay for the cost difference, because that child's not going to be able to be successful in this regular group session with 8 kids or 10 kids, and so the waiver could pay. It's kind of a cost sharing, right? The waiver would pay those additional costs because now the child needs something that is way more expensive than that standard class. So we're kind of thinking of that in the same way for some of these other activities, recreational type of activities. Next slide. So for the provider qualifications, kind of similar to what we've had in the past, with when we're thinking about individuals and vendors that are providing any of this. So right now, with some of the equipment and supplies and dietary stuff and adaptive clothing and a lot of those things, we say that any vendor that's providing anything must have all the necessary professional and or commercial licenses required by federal, state, and or local statute and regulations, if it even applies. So we know right now that sometimes people are getting equipment and supplies through Amazon, or it's their grocery bill that they're getting reimbursed for a portion because of the additional specialized foods. We're paying mileage. What else is under that category? So this is how these provider qualifications are kind of what we have said before, and that anything that is under the individual directed goods and services category is all billed through the FMS provider, and that whatever the provider is providing, the service that they're providing, they must be able to demonstrate to that person that they have the capacity to perform the requested work and the ability to successfully communicate with the person. Next slide. I think we're getting a lot of questions there. So, all right. Now, I think Rebecca mentioned this earlier, so I'm just going to reiterate what she had already said. But we know when we're talking about individual direct goods and services, we know that there's a lot of people using CDCS that have a lot of requests for equipment and supplies and sensory items and a lot of items. And it's sometimes difficult to evaluate whether those requested items meet the basic waiver criteria for allowable expenditures. Sometimes we enlist a lead agency might ask any kind of a medical provider, a specialist to evaluate, something, whether it's an OT or a PT. But remember that, like Rebecca mentioned, that just because there's a recommendation for any particular item from any specialist or a doctor that doesn't necessarily dictate who's funding the recommended item. So I always say too that if there's a recommended item, or if a doctor said this is a medical necessity that they have this, then that needs to go through the medical insurance if it's a medical necessity. Waiver dollars is disability related need. So there's still some evaluation that the lead agency should do when evaluating these requested items. This is not easy. I know it's not easy. I'm not claiming it's easy for any of you to evaluate this, but sometimes I think that it's misleading for people, participants, or families to have something signed, and that in and of itself, they expect then that the waiver will automatically pay for it. So even with that, you still need to apply that basic waiver criteria. All right, questions? I know there's a lot.
Yeah, so we have one here about just asking if the internet utility thing, if the internet as a non-covered item is going to be included on the CVSM new published category for individual goods and services. Are we going to, put that in the list? And I believe that answer is yes. I think it's there.
It is there. Yeah, we redone all of our policy pages. They're all ready to go, really. And so we have all of the updated policy pages completed. We have our forms completed. And we've also started a pretty extensive document that we're hoping eventually will be the resource document, like a consumer handbook, calling it something else, specifically for participants. In addition to that, right now we have online learning modules. One for lead agencies, one for support planners, one for participants. Those are all also being updated to reflect all of the new information that we're providing today. So there's a lot of background work that's being done. So all of that, and I also want to say too, if once we do launch everything and it's all available, please let us know if there's something that maybe isn't clear or we're missing. But know too that we're not, our policy pages, it's almost impossible for those policy pages to address every single scenario. And also know too that there's still an evaluation that a lead agency is responsible to perform that is the person-centered, right? So we always say, even though something is allowable, doesn't mean it's approvable for all, right? It's not about the item. It's about the item in relation to the person. All of that remains, all of that evaluation still needs to happen. And so, but please let us know though too, if once you see things that's maybe not clear. We've done our best, but we've been in it for a while, so maybe we've missed some things too.
Yeah, and then I don't know if there's anything in this list here. We've got a couple of questions. But I'm noticing that we do still have to go through community integration and support and implementation. And I know people are really interested in hearing those things too. Do you want to try to grab a couple of these questions, or do you?
Yeah, let's do a couple of questions here too. I think we might be able to, answer some questions. We're talking about adapted clothing. There are many options available for adapted clothing and cost neutral compared to adaptive options. That said, does DHS have any direction on how to approve these items considering the changing markets? I don't know that I have any, I don't know that we have necessarily anything specific about that, but I just know that I think whoever asked this is correct in that there are a lot of options for adaptive clothing that address a lot of different things for people, and sometimes the cost is a little bit more upfront, but it's there. The items are intended to address the things that we're trying to address, to make them more durable and safe and long lasting, all of that. Okay, that one's already been answered. Yep, okay, you guys did that. There was a note about at a recent assistive tech training about adaptive bikes. So I'm not sure that adaptive bikes are considered assistive technology. I'm not sure.
And there's a couple notes about that, about the tech meetings. There's another one in there.
Yeah, I think the other question really was about if an item is covered under MA and there's not a durable medical equipment provider in the state that will provide the item through MA, is it considered available through another funding source, or is it allowable? You know, there's always some different scenarios here, you guys. I mean, so when we talk about, you know, we have this thing that says not available other funding sources, and we're trying to provide some explanation of that. There's always going to be some of these outliers. There's always going to be outliers, and I don't know it. You would have to reach out to us directly, because we would need to know what specifically this means as far as nobody's available to provide it. Okay. Okay, let's see. Anything else?
Well, I think some of them are, you know, about specific situations, like for swim lessons and things. So we're kind of getting into some really specific situations with specific, you know, persons assessed needs that you know, we're getting a question about, you know, well, if it's this, if it's that. If those things come up, just email us about specific case information. That's what we meant at the beginning when we're like, we can't really answer questions that are super specific like that. Like, well, what if this, and what if this, and what if this? Like, once the pages are published, and like Cindy said, is if you have these scenarios you're concerned about, you know, send them in to us, and we'd be happy to take a look at it and maybe guide you through some of the thinking and the decision-making process.
Can I just respond to one question? I think it's important, and that is I gave my example of swimming lessons, and only because that is something that we had a solution or a compromise that we had provided years ago about situational things with some kids that are successful, let's say in a standard swimming lesson. And the question is the question today is, can we reconsider swim lessons as a necessary health and safety skill versus recreation on an individual basis? For example, if they seek out water or sensory areas due to disability, like, you know, the kids with autism, and they need adaptive training to build safety skills to access their community safety, especially since we live in Minnesota, that the entire cost should be covered, and it's not for recreational purposes, but for safety. And that has been, I just want to say, it's a good comment. It's not something that it has not been discussed internally at DHS. It is, we've heard this before, is it recreational, or is it an actual, you know, needed skill, safety skill that some of these some of these children should have? And that is something that is a bigger discussion than this. And part of this is because if that's the viewpoint, then how would somebody on traditional waiver get it paid for, right? So how would we be able to do that? So we're also talking about not only categorizing in a certain way, but also, you know, equitable access to this. So this is definitely something, I just wanted to comment that this is something that we are talking about internally and are not taking this lightly. viewing that in a certain way. So thank you for your comment or question. Okay, next.
Yeah. And Cindy, maybe we can start with the community integration support. And if you want to look through the other questions, if there's something you want to address after the section.
Okay.
Okay.
Sounds good.
So let's talk about a new category. It's kind of exciting. The community integration and support category. So this is new. These are going to be for services that focus specifically on a person's successful participation in the community and community membership specifically. Next. So community integration and support, the outcomes are for services to help a person safely live in the community, to participate as a member of the community, develop meaningful day support and community engagement, to help improve social skills and their community behavior, to help them build relationships and improve their mental health. Okay, next slide. And so to continue with that, the way that those outcomes are met is the person directly hires workers under this category. And those workers can provide support and training to help the person engage in activities that develop and strengthen relationships with community members, to self-design day supports that establish their regular connections to community members, to increase their community independent living skills, participate in community events and groups, organizations, clubs, etc., and to contribute to their community through volunteer experiences. And I just want to make a note here, just because we had some questions at our last webinar on this. The self-designing the day support services would be for those folks who've decided that, you know, employment isn't something that's working for them or that they're interested in. And so then they'd be able to use this category to self-design those day supports. Next slide. Some examples of how this might look for someone it would be that the person would hire a worker to provide them with access and support in this category to help them maintain and develop skills to volunteer at the local Humane Society, or maybe they're interested in books and they want to build relationships by attending a community book club, or they want to increase their natural supports and relationships in the community in their neighborhood. So they are going to get some help in order to attend the homeowners association meetings. And then it's important to mention that the cost for the worker, the actual worker wages to attend is covered under community integration and support. Mileage for that worker, if that worker is transporting the person to these places, would be under individual goods and services. Just a note there, how that might be split. Next slide. So just similar to personal assistance category, the costs that are related to hiring workers would also be contained in the community integration and support category, such as the fees and taxes and benefits for a person, for a worker. So paid time off on holidays, etc., similar to personal assistance. Next. And we're at questions again. If you guys have them, please go ahead and put them in. The chat, or the Q&A, rather. Let's see, Cindy, was there anything that you wanted to address?
Add to?
Yeah. I'm looking at, there's a question about the internet again, about whether the internet, you know, the policy pages for the CBS, so individual goods, directed goods and services is not currently a service under CDCS. It's not, I'm sorry, a category, right? And so when that page is published, it will have that internet piece on there as a non-covered.
Yeah, I also received a private message too. Everything that we're talking about today will be our unbundled policies, that all of those have not been published yet.
Yeah. There is a question here. What if a staff person is also providing personal assistance? What category does that go in? And we had a lot of conversation about this last time. Cindy, do you want to kind of share how you answered this question before?
About what?
About someone, a worker under personal assistance who occasionally takes someone to a home association meeting versus, you know, do we have to separate that time out specifically?
Yeah, no. Yeah, so we you know, that this is going to be one of those things where people are have questions about an individual that is hired under personal assistance. We know that that person's providing assistance with ADLs. They might be helping someone with a bath. They might be taking them out in the community. They may be doing a variety of things. Just because they're taking them out in the community doesn't mean it needs to go into community integration and support. Community integration and support is a kind of a specific category that, if you look at the intent of it, or some of the things that are the purpose of it, it really is about community membership, attending homeowners association meetings, getting involved in a community organization, something like that, where versus the personal assistance worker that is also taking people out in the community. You don't have to split any of that up. It doesn't have to be, you know, the personal assistance worker that takes someone out periodically. That's all under personal assistance. Just know that we know that there may be some gray areas, or people may wonder if it goes in one or the other. And as we start implementing this, it might be clearer the distinction between those. But for now, I don't know that we have to be, you know, too wound up about it necessarily. Somebody asked about yesterday. I think they asked the question about whether that has to be split. It doesn't have to be split into those two categories. That wasn't really the intent of that. Also, let's see, was there something else?
Well, yeah, there was a question
yeah.
about people writing their own plans and how will they be notified. And I was just going to mention that we do have trainings being developed for the participants as well. That will be coming out soon.
Right. But even the question talks about when a staff person's providing personal assistance while they're under the community integration and support. Right. Well, part of what category does it go in? It's under community integration and support. So even if you're doing something under the community integration and support category, and you're happen to provide an ADL support, it would still be under community integration and support. It isn't quite that detailed or distinct. If you have the same staff person who provides tasks of both personal assistance and community integration, would you separate the hours each? No, you don't need to. Okay. Yeah, when will the unbundling be published? And that is, yeah, at the end. Okay, already answered that. Yep. Okay. All right. Is there anything else you think that we have to address here? No.
I think so. I think we'll go through these next ones. They're pretty simple. So we'll just keep rolling here. So environmental modifications, as Cindy had mentioned before, are being split between home and vehicle, right? Environmental modifications and provisions is becoming environmental modifications home and environmental modifications vehicle. Next slide, please. And as that's what Cindy had mentioned, that we were directed to divide them up, but there's been no policy changes to those familiar things. So we'll go ahead and go to the next slide. And again, with the vehicle, you can go ahead on the next slide. Same thing. We were directed to separate these out, but there have been no policy changes. You won't see anything different. And next, Financial management. Do you want to go ahead and take this one, Cindy? The next ones?
Sure. Sorry, I had to double unmute. So for financial management services, as I mentioned earlier, all we did was split that out from the self-direction support activities. It's going to be a separate service category. There are no policy changes to that. The next one is the CDCS support planner. Same thing. We have it as a separate service category, but we have not made any policy changes. It was just how we split up the categories. So they're just a separate one for FMS, separate one for support planner. Next. Okay, implementation. I do see one question. I just wanted to circle back because it may not have been clear about community integration support. And the question was about, is the new service something that can be provided only by someone hired directly by the person? And the answer is yes. So there are two service categories that, service categories that are only workers that are directly hired by the participant. Personal assistants, those workers are directly hired by the participant, and community integration and support, those workers are directly hired by the participant with the assistance of the FMS. So those two categories, just directly hired workers only. Okay, so implementation. Now, how are we going to do this? When are we going to do this? How's this going to work? So first, we haven't announced anything yet. Like we talked about earlier, we have everything pretty ready to go, but there's a lot of behind the scenes stuff. We are adding additional modifiers for billing, finishing up forms. We have a CDCS community support plan template that's been updated, all the forms we talked about, all the policy pages we talked about. All of that stuff is really getting pretty ready to publish. So where we will send an e-list announcement like we do for everything that we implement to announce the effective date of when we're going to start. And so part of that, like I said, we'll be publishing all of the web content, the updated learning modules, the policy pages, the forms, everything. Next. And how we want to do that is we call it a rolling implementation. So meaning that this is not going to be, today it's old and tomorrow it's new. So we're going to do a rolling implementation. So people that are currently CDCS participants will just continue as they are through the remainder of their plan year. Nothing has to change for anybody. We don't want anything to have to change mid-year for them. It's just going to cause confusion. And we also don't want people to have to spend additional money to have a support planner help them, create a different plan, a new plan. So what they're going to do is they would transition then to the unbundled policy with the new forms, new policies, new categories after their next reassessment. So after their next reassessment, it's kind of typically when they have their reassessment is when people start planning for their upcoming year. That's when they start maybe starting to create their plan. That's when they're going to do it. So for some people, it's going to be a year. I mean, it's going to be a while, right, before they implement the unbundling. For new people coming out to CDCS, it's after we announce our implementation. Those new folks will start right off the bat with all the unbundled policy and forms and CDCS community support plan. So what that really means is that we have the old or current CDCS and the new unbundled operating simultaneously. So it's going to be a little clunky for a while, but we really, really want to make sure that this is the least disruptive to people. This isn't a lot of these changes are really because of how we've developed or created the framework of this program, and it shouldn't affect, besides the couple things we talked about, it really shouldn't throw anybody off and affect services. So we don't want people to be changing things before they need to. Next slide. Okay, so this is where we're going to ask support planners not to revise anybody's current plans. And that's just because there's no need to do it now, right away, for anybody. You can wait until their next renewal, and that's when they can switch over. We don't want them to incur any additional cost to pay a support planner to do that, because there's no need to do that. And so, but support planners that are working with new people, so anybody, so support planners who use the updated CSP when assisting new participants whose plan begins on or after the unbundling effective date. So those new folks will start off with the unbundled policy. Hopefully that makes sense. So it's rolling implementation. Okay, so next slide. Okay, I do have a good question here. If someone uses CDCS but also accesses traditional waiver services, has this been discussed as to what category these should be in? Is there a crosswalk that could be developed to assist with sorting these into the new categories? So I think I mentioned earlier, it might have you might have missed it, that's okay. But what we have decided is that anybody that purchases any traditional waiver services with their CDCS funds will be put into the person's plan under individual directed goods and services, all of them, all traditional. So, and that will be on our policy page. Yeah, oh, you already got that, okay.
And then how about
Okay,
this one, Cindy? Is there a rough timeline of when this will roll out? And in addition, is there going to be a new CDCS CSP?
Yes. So we don't have to wait till 2025. We want to implement as soon as possible. We always are very hesitant to give a date or even a potential date, because we know how that goes. Sometimes there could be a snag over on our end, and even though we're all ready to go, there could be some system thing that isn't done or something. But we are hoping to have this implemented by the end of, obviously by the end of the year. By the end of the year, for sure. So remember to just watch for an e-list announcement to provide the date that we're going to start. And just know that this isn't going to be everybody all at once. It's just going to be this rolling implementation. And we will have, as we mentioned, there is a new CDCS Community Support Plan template, the 6532, along with the other forms that we mentioned, along with the online training modules, along with the all the other forms. Yeah, and another really good question. Will the MA home care nursing still have a section to be separated and put into the MMIS separately? Nothing will change with that. So currently, right now, when anybody uses their CDCS funds to purchase any MA state plan home care service, that is always authorized separately, put on a separate line item. It's taken out of the budget, but it's authorized separately, and there will be part of the CDCS Community Support Plan, there will be a section for MA State Plan Home Care Services, as there is now. The other question is just another clarification. To be clear, all traditional waiver services are allowable under CDCS, but they just go into that goods and services category, even if they are providing personal assistance. Yes, that is correct. Any traditional waiver service that someone wishes to purchase using their CDCS dollars will go under individual directed goods and services, regardless of what the service is. Okay. Anything else? We only have a couple minutes left. We have gotten through. You can go to the next slide. I think it's just a thank you. We also wanted to
Cindy?
remind you. Oh, go ahead.
Sorry, I think this might be a good question. I just was noticing here. They're asking about the $40,000 per year maximum. I think they're
Yeah.
talking about waiver maximum because can you address how the $5,000 will work?
I think I think we were talking about the $40,000, yeah, maximum for home and vehicle modifications. Nothing's changed with that at all. The CDCS follows that same maximum for home and vehicle modifications. Nothing has changed with the policy that states that individual needs to contribute the first $5,000 out of their CDCS budget for home and vehicle modifications. There's no changes to that either. So many things that we do are, not so many things that we do are aligned with the traditional waiver services or waiver policy, right? We talked about out-of-state travel. We talked about some of those things. That's all anybody that's on waiver, right? So we've tried to, in our policy manual, say, in our CDCS policy manual, say the limitation is the same as all waiver participants, and then link to that page. So unless it's CDCS specific, we will address it as CDCS specific, but otherwise we would adhere to the general waiver policy.
See any new questions?
I don't either. The one thing I do want to mention on this page is that we have two email addresses, and the one that we have listed for myself and Rebecca is the DST consumer directed email, and that is a general email that we use specifically for CDCS. There's only a few of us that man that email address. We also encourage people to continue to use that DST contact form. It's surprisingly effective. It really does get to the right people when you use that DST contact form. The other email address that I have listed is for Dawn, and so that's Aging and Adult Services, and they have a very similar system where they have a standard DHS AASD or Aging Adult Services email address that you can use also to reach out to Dawn and her team. Yeah, there were a couple questions about those limitations for EW, and that's also will be part of our policy also for home and vehicle modifications. Somebody asked a question about that. But well, thank you all for attending and hanging in there with us. And let us know if you have any questions. You can feel free to either use the DST contact form or that DST consumer directed email. But just know too that as we implement our unbundling and roll out and publish all of our policy pages, hopefully that there'll be some clarity on some of the policy pages that maybe we weren't able to address today. And if not, let us know. And thank you for joining us today. Have a good rest of your day.